Good afternoon, everyone. Good afternoon again. So I'm presenting here Sanofi Symposium, which actually complements my previous talk, where I'll be talking about challenges in achieving glycemic targets in diabetes, and with the focus on Glargine 300, we're making the ideal even better. So I'll be focusing on Tujeo, which is insulin Glargine 300, which is a novel next-generation insulin Glargine for the treatment of patients with diabetes. So as an introduction, actually maintaining good glycemic control is important in people with diabetes to avoid the microvascular and macrovascular complications associated with hyperglycemia. However, large prospective studies have shown that optimum glycemic control is not achieved routinely in a clinical practice, where poor glycemic control in type 2 diabetes is a global problem despite the availability of numerous glucose-lowering therapies and clear guidelines for type 2 diabetes management. And that's what I referred as clinical inertia in my first talk, where this gap between best practice and current level of care is most pronounced when considering insulin regimens, with the studies showing that insulin initiation and intensification is frequently and inappropriately delayed for several years. So despite the potential of insulin therapy, patients are not in control, where barriers to optimal insulin therapy include the suboptimal dose titration. So what are the challenges of insulin self-titration? I mentioned some of them, but mainly the effects of insulin therapy on quality of life, where it's considered a burden on patient's life, and the lack of flexibility, where the patient has to take the injection every day at the same time with certain meals, and the complex titration algorithms. Sometimes, no matter what you explain to the patient, they still find it difficult to apply. And the lack of constant glucose monitoring, whether the patient does not have an access to a glucometer or not motivated enough to do the glucose monitoring. And of course, the lack of education and the fear of the major side effects like hypoglycemia and weight gain. So reasons for not achieving glycemic goal for people on basal insulin is mainly inadequate titration, for ongoing fear of hypoglycemia, whether by the patient or the physicians, and the ongoing fear of weight gain, and the lack of healthcare provider resources, assistance, and education for patients regarding effective titration, and the concerns about impact on daily life that can result in insulin omission and infrequent self-measured blood glucose testing by the patient. So even with the significant advances in basal insulin, there is a compromise between glycemic control and hypoglycemia. So the risk of hypoglycemia and its consequences will lead to suboptimal insulin use, and this suboptimal insulin use experiences will steer the patients away from their goal. And here where aspiration for a new basal insulin evolved, where there is a need for a stable and prolonged pharmacokinetic pharmacodynamics profile, and the need for low hypoglycemic risk to support the titration to reach the goal, and there is a need for more flexible injection time for the changing demands of daily life, and there is a need for long-term safety and weight neutrality. And here, what Tujeo would really be offer, and what can be attained with Tujeo as a novel next-generation insulin Glargine, where it will offer a more stable and prolonged activity that goes beyond 24 hours, with a lower risk of both nocturnal and anytime hypoglycemia compared to Glargine 100, and the advantage of dosing flexibility that is needed, and the long-term cardiovascular safety and clinical experiences of insulin Glargine, and significantly less weight gain compared to Glargine 100. So Tujeo, which is a novel insulin Glargine formulation, Actually, it forms a smaller subcutaneous depot with half surface area compared to Lantus. And this smaller surface area actually gives a more sustained release and flatter profile that goes beyond the 24 hours and up to 36 hours. And Tujeo has actually the same metabolism as for Lantus. So Tujeo, compared to Glargine 100, has a more constant and a prolonged pharmacokinetic pharmacodynamic profile that goes beyond 24 hours, as you see here in the activity profiles. So Tujeo is actually associated with less glucose fluctuation with its prolonged activity, as you see here, where it shows a flatter glucose profile compared to Lantus, especially in the last 4 hours before the next regular dose, where Lantus can have some diminished action sometimes in the last 4 hours and leading to a higher glucose profile at these 4 hours. So I'll be talking now about the Tujeo clinical development program, which is called the EDITION clinical trial. The EDITION program actually consists of many trials where Tujeo was studied versus Lantus in different population, as you see here, involving patients with type 2 diabetes and with type 1 diabetes. And the total number of patients in the EDITION program is around 3,500 patients. So I'll be focusing on type 2 diabetes trials, where we have here the EDITION 1, EDITION 2, and EDITION 3 trials, and the Japan trial. So in EDITION 1 trial, actually, patients were on basal bolus regimen, and then they were randomized to either Tujeo or Lantus. In EDITION 2 trial, patients were on basal insulin plus oral medications. And in EDITION 3, patients actually were insulin naive, did not use insulin, and they were randomized to either Tujeo or Lantus. So the study design for the EDITION trial, as you see here, was consistent across all the program trials, where after randomization, one-to-one randomization, patient would receive either Glargine U300 plus minus oral anti-diabetic drugs plus minus prandial insulin, or Lantus with the same interventions. And patients were followed for 6 months, and then the study had an extension period for another 6 months. And the study looked mainly at, or the primary outcome was non-inferiority to Lantus in HbA1c reduction at 6 months in all these trials. So I'll be talking about the pooled analysis of the EDITION 1, 2, and 3 together. And as you see here, the baseline characteristics of patients with type 2 diabetes in these trials and in the pooled analysis. And I have to mention that in the EDITION program was built with similar design all over these three, all the trials actually had similar study design across the trial, and that was to confirm the results. So the results showed after 6 months in regard to the primary outcome, there was similar reduction in HbA1c and with Tujeo versus Lantus in all type 2 diabetic trials. So as you see here in the pooled analysis, there was a similar reduction in HbA1c from baseline by 1.42%. And actually, this reduction in HbA1c was sustained with Tujeo even at 1 year with the follow-up extension period compared to Glargine 100, as you see here in the graph. What about hypoglycemia as a safety endpoints of these trials? Actually, Tujeo has consistently demonstrated less risk of nocturnal hypoglycemia compared to Lantus in a broad range of type 2 diabetic patients, as you see here, whether in type 2, in EDITION 1, EDITION 2, EDITION 3, and the pooled analysis as well, where the plots of the relative risk of experiencing one or more confirmed or severe nocturnal hypoglycemia favors Tujeo than Lantus. not only nocturnal hypoglycemia, but also both nocturnal and any time of the day hypoglycemia. Tujeo offered significant lower risk of hypoglycemia, as you see here, at by 14% less risk at any time of the day hypoglycemia, and 31% less risk with nocturnal hypoglycemia, where you see there is early separation of the curves and sustained separation for Tujeo compared to Lantus. And that was even elaborated further in the Edition 2 trial, where switching to Tujeo, where patients were already on basal insulin, and switching to Tujeo in Edition 2 showed significant less risk of hypoglycemia by around 48% in nocturnal hypoglycemia and 23% for any time of the day hypoglycemia. And in the Edition 3 trial, if you remember, I mentioned that patients were insulin naive, where they were started either on Tujeo or Lantus. The study showed that Tujeo offered lower risk of any time of the day hypoglycemia compared to Lantus, including the titration phase. So in the titration phase, there was 39% less any time of the day hypoglycemia with Tujeo compared to Lantus. What about other important outcomes, which is weight gain? The pooled analysis of Edition 1, 2, and 3 showed significant less weight gain at 6 months and beyond with Tujeo versus Lantus by 35%. And specifically in the Edition 2 trial, where patients were switched to Tujeo, it showed a significant less weight gain in patients who required titration and actually shifted to Tujeo by 88% less weight gain compared to Lantus. That was in regards to the Edition trials. And now I'm showing you a graph from a CGM study, a continuous glucose monitoring study for Tujeo versus Lantus injected either in the morning or evening. As you see in the Tujeo graph, there is a more constant glucose profile with Tujeo compared to Lantus or Glargine 100, regardless of the time of injection, whether in the morning or evening. So as you see here in the dotted line, it was in the evening administration, and the complete line for the morning. So it showed a more stable and constant glucose profile compared to Glargine 100 or Lantus, where there is a variability when the injection time changed from morning to evening. So Tujeo offers flexibility of 6 hours window plus minus 3 hours of administration due to its extended duration of action lasting up to 36 hours. So in conclusion to the Edition trial and these trials, that the Glargine 300 in comparison to Glargine 100 provides more constant and prolonged pharmacokinetic pharmacodynamic profile and lower glycemic variability and more stable blood glucose control beyond 24 hours. And there is a comparable HbA1c reduction in the treat-to-target randomized clinical trial setting. And there was a lower risk of confirmed or severe hypoglycemia during the 6-month treatment period, including the titration phase in type 2 diabetes, and more flexible injection time to either morning or evening, and within a plus minus 3 hours window when needed. It also offered less weight gain and similar overall safety and tolerability. And of course, it has the same metabolism of Glargine 100, supporting the long-term cardiovascular safety. And now I'll be talking about real-world evidence, where now people are more interested in, as the randomized control trials actually having this highly selected participants and this rigid inclusion and exclusion criteria with the frequent follow-up of the RCTs, that the results may not be truly representative of real-life clinical practice. And the results of these RCTs sometimes cannot be generalized to clinical practice. And here I'll be talking about real-world study. What is real-world evidence again? It's evidence obtained from real-world data which are observational data obtained from or outside the context of the randomized control trial that is generated by analyzing data which is stored in electronic health records. So it's from actual patients, and that is needed to bridge the gap between the controlled environment of an RCT and the harsh realities of the real world. So the DELIVER program is the real-world evidence study for Tujeo, where the effectiveness and safety of Glargine 300 were compared with those of other basal insulin, like the second-generation basal insulin analog, insulin degludec, and or the first-generation basal insulin analogs, Glargine 100 or insulin detemir. And that was in people with type 2 diabetes who were either initiating insulin, who were insulin naive, or switching their basal insulin. So the DELIVER program actually covered broader diabetic population, including those with different baseline medications and comorbidities, reflecting more your daily patients. So what the study found briefly, it showed that switching to Tujeo actually reduced HbA1c by 0.64% from baseline after 6 months from switching to Tujeo. What about hypoglycemia? The study showed that switching to Tujeo reduced hypoglycemia in type 2 diabetic patients and specifically reduced the events related to inpatient or emergency department encounter, and that was by 48% after switching to Tujeo. And one trial that looked specifically at high-risk patients for hypoglycemia who were elderly, age 65 and above, the trial showed, or the study showed, older patients experienced less hypoglycemia when switching to Tujeo versus other basal insulin, and that was by 57% risk reduction. So the conclusion of the DELIVER program here, that the results of the DELIVER program, which represents clinical outcomes in real-life people with type 2 diabetes who initiated or switched to Glargine 300, actually complement those from RCTs in which Glargine 300 was compared with first and second generation basal insulin analogs in people with type 2 diabetes, where the DELIVER studies showed similar anti-hyperglycemic effectiveness and a lower risk of hypoglycemia with the Glargine 300 versus first-generation basal insulin in people switching basal insulins, and extended those findings most notably to older adults and those at high risk of hypoglycemia. So starting right with Tujeo in your patients with type 2 diabetes. So for type 2 diabetic patients who are insulin naive, when you start on Tujeo, you start with a 0.2 unit per kg. So this is dose calculated based on the body weight. But if patient is already on a once daily basal insulin, then you follow a 1-to-1 conversion with no dose recalculation required. However, if the patient is taking a twice daily basal insulin, then you will start patients on Tujeo by 80% of the total daily dose insulin that the patient is taking, and will be taking as a single dose of Tujeo. And later on, of course, you should advise the patient to titrate the dose once or twice weekly. So if fasting sugar is above 140, can increase by 6 units. If it's between 100 and 140, increase by 3 units. If the fasting sugar is between 80 and 100, then the patient is at goal. But if there is hypoglycemia, then patient should reduce the dose by 3 units. And of course, these targets should be individualized according to your patient. So finally, I'm showing you here the Tujeo redesigned Solo Star pen, where it has a concentration of insulin Glargine 300 unit per ml. The pen has 450 units per pen versus Lantus, which has 300 units. And as you see in the dosing window, it shows a single number, which will facilitate the 1-to-1 unit conversion from Lantus. And even with the injecting button, actually, patients has to hold for 5 seconds versus 10 seconds with Lantus. And so it showed that for the same number of insulin glargine units injected, the volume of Tujeo is actually less, around 1/3, and that will reduce actually the injection pain, where patients now new to insulin consider that Tujeo Solastar pen is easy to learn and easy to use. So I'm concluding my talk with that Tujeo making the ideal even better with more stable and prolonged activity profile beyond 24 hours and lower risk of both nocturnal and any time of the day hypoglycemia compared to Glargine 100, and significantly less weight gain compared to Glargine 100, and the advantage of dosing flexibility when needed. And thank you.